We had the first confirmed death from COVID-19 in the United States here in Washington State, in the Seattle area. And one of my former coworkers and a friend of mine was a photojournalist covering that story and contracted COVID-19.
We are in Clearwater tonight. I'm Allison Morrow.
Hi, I'm Allison Morrow.
I'm Allison Morrow.
And I've gone to a lot of places.
On St. Pete Beach, Allison Morrow.
And now with my former Force Recon Marine husband, I'm going off-grid-ish.
Tim, you are a former coworker of mine. We worked together at the Seattle NBC affiliate King 5 before I quit my job last year to move into this Airstream we're renovating. You're still there, though, and you're one of the brave people that's covering this coronavirus pandemic, and we're right there at the facility where the outbreak originally, where the news was centered, and where it may have begun, and you may have actually contracted it from covering this story. We don't know.
Right now, I feel great. Today's day 11. I started feeling better around day 9. Last Saturday, I was just started coughing and didn't feel right. Started feeling the fever come on and kind of talked to my wife like, I feel sicker than I normally would just with this cough. Because I've had an allergy cough for like 3 months, so nothing really changed there. And then all of a sudden I was like, nope, I feel a fever. It stretched over the course of 10 days, 11 days. I still have a cough, so I'm not out of it yet. But it's more of the doctor's calling it a relief cough because it's clearing my airway and it's helping me breathe. I'm not doing the dry cough that everybody keeps reporting, where you're gasping for air. Mine is more to clear my airways and helps me breathe better. But the fever part seems to be done, which is all I care about because that was an absolute nightmare. 9 days straight of a fever. You get delirious, you get tired, and you're just kind of over it and you feel like it's going to be permanent. But what really kept me going through it all was watching and hearing from other people's stories that have either gone through it or were in the thick of it. And getting that kind of information for me is what helps me and relaxes me. You hear the bad stories, the woman found in her apartment with her 4-year-old standing over her, or just the absolute terrifying stories that this disease is coming out with. Those build the anxiety and the concerns, and especially when you're in it, you're like, I could get worse any minute now and have to go to the hospital, and I'm going to be one of those people in the breathing tubes, and all of that goes away when you hear the positive stories come out of this. People, let's face it, 90-something% of us will survive this thing, and that's a number that you have to keep telling yourself when you're in it, because if not, you get that anxiety starts to take over, and the worst thoughts come.
Right, and also not just from like the physical side of the symptoms that you deal with, but the isolation, I'm sure, and just like the psychology of overcoming this is tough because what's life been like for you?
It's definitely obviously isolating. People have been so supportive. People have been dropping off meals to us. People have been sending us gift certificates for Grubhub. This whole thing kind of opened up. We're not from the Seattle area. We're from the East Coast. So we don't really have many close family friends out here, I would say. But this has really opened up both of our eyes to like, hey, we actually do have like a really solid support system out here that I didn't realize we had. And people have been awesome, just sending us daily updates, checking on us, making sure we're not getting worse. And then it goes both ways because I feel like, people are so nervous and scared during all this. To hear from somebody who has it and is fighting a temperature and fighting it, to hear from me to say, it is bad, but you can get through it. You can breathe. You can just take it slow, drink tea, catch up on your shows, read your books. And it's not the debilitating pictures that you see coming from the news or the internet just about people in ER. I mean, that certainly is happening, but it's not going to be the majority of people that it's happening to. So that kind of, we just keep telling ourselves over and over, like, majority of people are fine after this. Majority of people get through this. Just to see everybody, the outpour pouring of support has just been really amazing.
Right, in a city
Special.
that's known for the Seattle freeze, right, where people just leave each other alone and don't make new friends and everything. This is at least, I think, maybe melted that a little bit, so it's great to hear. You brought up news and the headlines around this and how scary some of the images are and stories that have come out of it. You're in the news business, just like I used to be, and that may have been where you contracted this, so I want to talk a little bit about that. What was it like when the news first broke that, hey, we're like ground zero, epicenter of this pandemic, which at the time hadn't even been declared a pandemic yet. So life has changed so much in just the last few weeks.
The Saturday morning, I woke up to a missed call from my manager, and all hands on deck, people coming in. We have our first death in Seattle, and this is going to be national. Everybody needs to rally together. I ended up not being called in that weekend, but I was there the following Monday at the Life Center in Kirkland. And everybody was there. All the major news networks all lined up there in the tree line at the edge of the property. We're just sitting there watching ambulance after ambulance come. And that was pretty much the theme for that week was we know there's going to be a crew there. We know we're going to be outside of it. And the best we can do is just keep trying to report that this is happening and it's here and it's in our backyard, and we'll just let it go from there. And the story just kind of kept developing. And then as the story developed, so did our guidelines of news gathering. We went from riding together in cars to nobody riding together. We went from, we started with no essential employees only reporting back into the newsroom. So because I'm a field crew, I'm a photographer out in the field with a reporter, we weren't supposed to come back to the station at all. So they started doing like a drive-through system with our, we call them backpacks. It's the technology that allows us to go live. They look like a small backpack. We started a drive-through with that with our engineers, so we wouldn't have to go inside. We would call them up and say, hey, we're out back, we need a backpack. They'd bring it down and deliver it. And that kind of was the theme for a week there. More conference calls came in, then they upgraded to more Skype calls. Now it's to the point where people aren't even leaving their homes really. The reporters are setting up Skype calls with whatever story you're assigned that day, whether it's, speaking to a scientist at UW or a doctor somewhere. You'd set up the Skype interview. I would be in my living room. I'd film like we are now, but I'd film with my news camera, aiming at the phone or the laptop, do our interview that way, gather our B-roll from past stories that we've done online, or even going out and just being by myself and filming the school or wherever we're doing the story at and putting the whole package together without essentially leaving our apartments is to where it is now. And, you're seeing more reporters going live from their living rooms. And yeah, it's become a brave new world.
Yeah, tell me about the story when you all were first covering the cases at the healthcare facility, where back then, they were like bringing stuff out of the building and handing it to people.
Yeah, I was told this story, but basically, yeah, they were coming out and handing out press releases. Like the people inside the life care center were physically coming up to crews and handing out their statements on pieces of paper, and the crews are taking the statements. That's a touch point. That's now we all know, like, don't share any physical stuff with anybody. It can live on surfaces. Back then, we didn't know that. We didn't even know it was an aerosol back then. It was just kind of, stay away, but it was less loose. People didn't wear masks. They weren't wearing gloves or handling stuff like that. So, very early on, this thing probably spread like crazy, and we were already too late.
And you also were using lavalier microphones, right? That you were putting on people instead of like the stick mic, which eventually became the option.
Yeah, we do not use lavaliers now. We don't even really use stick mics anymore. Now we use more of a directional microphone, which you could stand further apart, put that on a mic stand. So what we would do is go out, set up a microphone stand with the directional microphone that can be up to 6 to 10 feet away. And then you back away with your camera, go 10 feet back, let your interviewee approach the microphone and do it that way and never come within 6 feet of each other. And that's the second option. The first option that they want us to do is Skype interviews and FaceTimes. And if it must be in person, it has to be outdoors. Don't go inside any facilities anywhere, and perform all your interviews outside if you must.
I want to show everybody this live updated map of where the cases are of COVID-19 around the world. And obviously you see these red spots here, but 911,308 total confirmed cases as of the filming of this video, which will of course go up. And of that, 45,497 total deaths. So like you were saying, Tim, again, the vast majority of people are going to recover from this, but it is so much easier to focus on the really bad negative stuff that we're hearing. Curious, like when you're out talking to people about your experiences, which I guess you're not, but like on the phone or, you're Skyping since you're not out talking to them about it. But when you share your story, do you notice that people respond to it like the way you want them to? Do they sound like they're getting a sense of like, okay, this really helped me? Or do you feel like, I don't know, people are still just very apprehensive right now because there's just so many unknowns, like not just from the public health side of things, but the economic side of things?
I've had so many people message me personally because I've been doing daily updates on my Facebook just because I know people might be sitting there like, oh, he hasn't posted today. Is he, sorry, I just had low power. There we go. As he hasn't posted today, is he like in the hospital? What's going on? So I've been trying to do daily Facebook updates, and people have been messaging me personally and just saying like how much it has really helped and calmed their nerves, hearing from somebody who's in it. And that's my whole reason I'm talking to you. That's why I did a story with King, was because I want people to know and hear from somebody who has had the symptoms, gone through the gauntlet, and has come out of it, because I know how much it meant to me when I was in there. Hearing from somebody really helps.
What's next for work for you? When do you go back to work? You said that the company that owns King was nice. They gave you 2 weeks of time off paid, which is great. So you don't have to worry about that. Obviously, there are a lot of people right now that are hurting economically. So at least to be able to have that kind of relief is nice. What's the next step?
Basically, I was told whenever I feel like it, I can come back and let them know, and they will put me back in the mix. I'll be working from home 100%, especially if I'm still in my window of being able to spread this, which I'm told is 72 hours after my last symptom. I need to then mark 7 days from that point. So I still have a cough, so I'm still in the window, but I can essentially call work and say, hey, I'm feeling up for it. I can turn a story today. But they all know it's going to be from my apartment. I'm not going to leave. So once I feel that, I can pretty much make the call and get back into it. I believe my PTO, my paid time off window, is up until April 8th.
Okay.
So after that, I'll probably jump back into it.
And so you could, if you wanted to, even if you didn't leave your apartment, if you felt good enough, though, maybe you could do something from your apartment to start working again.
Yep.
I guess it's got. I mean,
Very lucky.
Are you just going stir crazy? I mean, how do you feel? What are you doing? How are you keeping yourself busy?
I wasn't so stir crazy when I was at my peak sickness. That's when I kind of was like sleep, wake up, drink water, drink Gatorade, drink tea, go back to sleep. That cycle, I wasn't as stir crazy just because I was like, I just need to get better. I just need to get better. But now that I'm like a little better and can like move around, and I'm totally bored out of my mind. I think I know every single title right now on Netflix. I think I can tell you what's on HBO. I need something to do. I cannot be over and just sit down and have a beer with people outside.
I think it's time for you to start your own YouTube channel.
I could. Yeah. I considered starting a sourdough starter YouTube channel.
There you go. I mean, I really admire you for your attitude and being willing to talk about it. I'm sure it has not been an easy route, and thinking like at the beginning, Because when you first got this, like we have said before, it has changed so much. Even within a day, there could be a massive
Mm-hmm.
change in the way we're handling this or what we're learning about it or treatments or whatever. So a week and a half, 2 weeks ago, I'm sure it was really scary at that
I
point.
kept hearing that you go from 0 to 60 within 4 hours. And when I first had my temperature peak at like the highest it went through the whole entire thing was 101.4. And on that day, I said to myself, "Oh my gosh, is this going to be where I peak to like 104-degree temperature and I need to get rushed to the hospital? Is that going to happen in like the next 2 hours?" And I would sit in bed and I would like just basically stare at a blank wall. Not even turn on the TV, but just sit and wait and stare anxiously. Is this it? Is this that 60-mile-an-hour window that everybody talks about where they just get totally wrecked and need to go to the hospital? Am I going to stop breathing any second? Like, yeah, that was very real. Absolutely. And when that wave would come, I would either try to force myself to fall asleep and get through that, or just pretty much wait it out and wait for the Tylenol to kick in and hopefully lower my temperature in that window. Yeah, it's definitely scary, but you just have to keep saying 90% of people will get through this. 90% of people get through this. I'm still only 31, so I still have my youth. Like, there's 0 cases in Washington less than 40 years old of people dying. So I kept telling myself that as well, repeating that over and over again to eventually where it passes and then the anxiety goes away. But yeah, it's for sure scary. Are you going to be that? Am I going to be that 131-year-old guy who ends up in the hospital? Am I going to be that statistic? Like, and then you get thinking even deeper of like, oh my gosh, my wife has it too. Who's going to take care of our dog? Nobody's going to want to come into our apartment that's infested with the COVID, and our dog's going to be home alone for 15 days. Is he going to survive? Like, then you start getting into that thought process. It's just a downward spiral of scary thoughts that you do go through, especially when your fever is spiking and you don't have your normal conscious thoughts to begin with. But you take a breath, you sit down, you get through it, and you remind yourself the numbers don't lie. Focus on the numbers. You're in the 90% window of being fine after all this. And, now I'm looking into options how I can donate my plasma or my antibodies to help science and move forward and hopefully come up with a cure for this thing.
Yeah, I thought that was really interesting when I saw you post that. I didn't even know that was a thing. So that's like actually something that people are doing.
I've got two friends who are actually journalists themselves who have both tested positive, and one of them made a post about, does anybody know I'm positive? Does anybody know where I can donate plasma or not plasma, but the antibodies? And this is all over. And the one repeating article that has been coming out is from the Mount Sinai in New York, is kind of on the front line of collecting samples from survivors to try to combat this and turn it into something good. So I wasn't sure if there was that was existed in Washington yet, but I figured it should because we are a very science-forward state. So I'm just waiting to hear answers, and hopefully there's somewhere I can go at UW or, Swedish or something where I can donate to help. That's the next step.
Yeah, that'll be your next news story, I guess. I have got to ask you, since toilet paper has completely gone missing in your area, how are you doing on that?
We have a bidet. So we have been, we've had a bidet for over a year now. So the toilet paper, we have a stack of it, but it takes us like 2 months to go through a 18 pack or whatever. I don't know what size pack we buy, but I know we don't buy it as much as we have in the past year. So we've got plenty.
Give us, since I love that you guys have a bidet, because I've been wanting to ask somebody about this because it's really becoming, I would love to get a bidet person on the channel, honestly, because I'm curious if they're seeing a lot more business. Maybe that's a story King can do when you come back to work. What's it like? I mean, it's just
it's great. It's an attachment that you could put onto. So we live in an apartment, so we rent, so we don't have like a big fancy bidet next to our toilet. It's an attachment that goes on the back. It plugs into the wall. Same water that comes out to fill up the tank in the back of the toilet is the same water. It's the same water that you wash your hands with. So it's not like dirty water or anything that people have a fear of. No, it's awesome. It's phenomenal. I always tell people, like when you go to take your dog out and you're walking your dog and your dog goes number 2 and you go to pick it up, you have the bag and the bag slips and you get some on your hand. What do? You go back and like take a paper towel and rub your hand off? No, you go wash it.
Right.
Same concept, just cleaner. Yeah, no, we love it. I love it. We've been using it for over a year now, and I think this is a great time for bidet companies to jump on the advertising.
All right.
I mean, hey, don't need toilet paper.
I think that's awesome.
It's time everybody's scrambling for toilet paper. I'm sitting back and just like, oh yeah, you guys go fight over your toilet paper. I've got a bidet at home.
Yeah. I mean,
You guys can.
we had bought some toilet paper before this was an issue, and I was like, I am not going to be one of those people that goes and hoards toilet paper. It'll eventually work itself out, but we still don't have any. And in our area, because we're 90 minutes from Seattle out in the country, but there are still people from the Seattle area coming to our grocery store trying to get supplies so they don't have to wait in the long lines at Costco or whatever else over in Seattle. They also are taking our toilet paper, so it hasn't been able to replenish. So I just ordered bamboo toilet paper the other day. So I'm going to try out bamboo. I don't know how it's going to work, but I did find that.
Bamboo gets advertised with the bidet company that I use. They have like some kind of partnership. But yeah, no, it's great. They're like $80. You can get them online, get delivered to your house in a few days, and attach it. It took like 10 minutes to attach. I actually convinced, we live in Washington, and I convinced family and friends in Connecticut to get one. So when I travel, I have a safe place to go.
I think as soon as we're done with this video, I'm going to go research bidets. That's the legacy you've left with me today. Tim, is there anything that I did not ask you about that you really just want to make sure that people hear? I mean, you got such a great story to tell, and really appreciate your being willing to tell it.
Yeah. Well, I just want people to know that that it ends. It does end, and you can kick it. Just rest. Don't push yourself. If you get shortness of breath, take a seat. Let it pass, because it does come in waves. So it's not a constant 100-mile-an-hour storm that wipes through. It's more of a wave that comes and goes as you get your symptoms and you feel a little better. Then they come back. Then you feel a little better. Just ride the waves out, and try to laugh. Just remember to laugh during it. My wife and I have been cracking each other up throughout this whole thing, and it's those little windows of laughter where I'm like, okay, we're fine. We're gonna this is good. We're okay. We're gonna get through this.
Yeah,
get it over with.
I think I told you that story about the guy I interviewed on the channel, Tyson Steele, who survived the 23 days in sub-zero Alaska after his cabin burned. And that's what he said too. Same thing. I thought was really interesting. Of all the things, like when I asked, what is it that got you through and you want to make sure people hear? And he said being able to have a sense of humor and laugh during some of this stuff. Like when he had like a can of chili, basically he thought it was his firearm going off in the fire and shooting bullets at him. And it was like a chili can that exploded in his face. And so he had chili all over his face. And being able to like laugh at that instead of just cry at how miserable everything is made a big difference for him.
Laughing is huge. Go watch Patch Adams, I say.
There you go.
Been watching.
Cool. All right. Well, Tim, thanks again for all your hard work as a journalist and buddy who's willing to tell people, come on your old washed up news reporter coworker's YouTube channel and tell your story.
No, thank you for having me. This is great. It's another mean to let people know to take a calm, relax, and we'll get through this together.
All right. Well, we'll be thinking about you. Take care of yourself.
Thank you, Allison. Take care.
Again, I'm Allison Morrow. If you're new to the channel, don't forget to subscribe and hit that bell icon for notifications when I upload a new video. And please share this video with anyone you might think would be interested in it. YouTube and a lot of the other social media platforms are censoring and shadow banning videos and content related to the coronavirus and COVID-19 issue. And so it's much easier for folks like myself to get the word out about these stories of hope and just the information people need if people like yourself who have watched it will share it with your own audiences. Again, I'm Allison Morrow. I'll see you next time.